Hey everyone, and welcome back to What After Dentistry. Now, we all know how important it is to have great clinical skills to practice in our dental industry, right? To deal with patients, to treat with them. So, we know the importance of these hard skills or technical skills or clinical skills as the way you want to put it. But in today's competitive world, it is also very, very important that you have some good soft skills or management skills to effectively manage your dental practice. Today's topic, we are going to talk about few management skills that are really important, especially for dental students and dental interns or fresh graduates, because these skills are something that are not taught while you are in your dental education years. So it is important that you start mastering these skills from the time that you get into internship and utilize your internship so that you get a good exposure on what kind of skills are actually important, apart from, of course, having a good clinical skills. How do you talk with patients, how do you communicate with them, what is the importance of patient education, record keeping, and so on and so forth. So we are going to talk about this topic, and before I get into the topic details, we are launching our second batch for soft skill training for effective dental practice. This will be a 2-day weekend workshop. As we conducted it in August, we are again starting off with the second batch in September. This will be most probably in 25th and 26th September, which is Saturday, Sunday. So it's a 2-day weekend workshop. Any one of you who is interested to join this workshop, you can register. The link to the registration will be there in the description, so do check that out. Now, coming to the video topic today, we had a small interaction with again Dr. Nishant Tiwari, who is an practicing oral and maxillofacial surgeon in Patna since last 7 years. So he has been effectively managing his dental practice, and we wanted to understand that what kind of management skills are required, especially for the new graduates or the interns basically who are there, and they want to start, or they are thinking to set up their own dental practice once they're out of college. So let's have a look at what he says. So, what are the business skills that you think? At the end, we also have to think from that perspective. That we have set up a clinic, we at least need to go to that break-even point. So, what are the business skills that a fresh, newly passed out BDS should have? Because these things are not taught in college.
These things are not taught in college. A senior is going to teach you, and if possible, you can flash my number to our viewers also. If they have any doubt, they can WhatsApp me. I would be happy to reply. Managing your dental clinic material wise is also very important. Yeah. Like in the beginning, don't buy so many materials which you are going to waste. Like for example, consumable materials, for example, alginate, your light body putty, your GP, your luting cements. These things, after they have a particular shelf life, if you are not going to use it for a certain period of time, it is not going to work as good as they were before. So don't buy it in a bulk. Be very slow and steady in consumable things. Buy good quality gloves, never compromise on that. You should always change the patient's, there should be a disposable glass, disposable suction tip, disposable patient drapes. These things matter a lot. Like patient should feel special. Like even in a small barber shop nowadays, they are taking out the scissors from a UV chamber. Yes. And good dental clinics, they are not. UV chamber is a small thing. 8 to 10,000 rupees, you get a good UV chamber. I know UV chamber is not a foolproof thing for sterilization, but for you can do a good autoclave, and then you can store your instruments in a UV chamber. It looks good to the patient. Patient feels clinic is standard. We should get treatment there. And as far as business is concerned, ma'am, in the beginning, don't think about the money. Think about the quality work. Money will run behind you. Believe me, money is going to run behind you. Just don't be lazy. Like I have seen people saying, okay, my time is from 9 to 6. If 6:15 one patient comes, I will not see. That is rubbish. At times you have to spoil your family life in the beginning, because one new patient, if you are losing, that means you are losing 10 different families, believe me, because one patient, new patient who had come to your clinic, he might have got a procedure done and he would have recommended 10 different families for sure. And you have to be little polite with the patients also.
Yes.
And one very important thing, ma'am, nowadays, Google reviews matters a lot. Reviews on any platform matters a lot, but Google review, you have to request all your educated patients to write a Google review for your clinic. Because in today's date, after 7 years of practice, at least 50% of the new patients coming to my clinic come after reading Google reviews, because that is a very in thing which was not there before.
Yeah.
So be very careful about Google reviews. You cannot delete the review. So you should have good reviews by good patients. So I request all my literate or advanced patients to write a Google review, whatever was their experience. Because at times there are few people who do give a very negative review also about your clinic. That is going to bring a very bad name. So especially you should be little polite in your behavior, but that doesn't mean that the patient will do whatever the patient feels like. Like there's one clinic which I was just going through, and I keep a track on the reviews being written on my competitors clinic as well. One of the clinics, someone had written ki that doctor such and such doctor is nothing but a blood sucking pest. Imagine the words written by the patient. Now you think yourself, if you had read that review, would you ever go to that clinic? No, you will not. So you have to be very careful about Google reviews also, and don't waste a lot of money in buying too many materials. Okay, when it gets over, you ask the local supplier, they will supply you.
Yeah.
But again, and make sure, like because of COVID nowadays, we are not having expo. Make sure you go to a good expo every year, especially like I make a point, I go to Delhi Expo because that is the biggest of all, because you should know what is happening happening in dentistry, in which part of the world something new is coming. Even after so many years of practice, when I go to Delhi Expo, every time I get to see some new instruments, I get to see some new materials, some new techniques. So you should keep yourself upgraded. Yes. So that is also very important.
I think that these are very, very important, tips and skills that you have talked about. Talking about inventory management, this is very important. What kind of inventory you need to have in the initial, how much quantity you need to have for each of the inventory. I think that's one of the very good and very basic business skill that one should have. Of course, communication skills. How do you talk to patients? What do you say to them? The way you interact with them, at what time are they coming? So all that also matters. So your communication skills, inventory management skills, and of course, marketing skills, like having a good Google review and asking your patients to write a review about you on Google is always going to help. So these are certain tips that you can start working on. And of course, these kind of tips or this kind of knowledge is something that is very vast. We can't compile it in 1 hour session. You can always, connect with Dr. Nishant. I will leave his, details in the description so you can check out and connect back with him.
And one more thing I would like to add, ma'am, patient time management is also very important.
Yes.
Always make sure you do all patients on appointment basis. You have to be little strict in that. I know it's not easy to do that in India because the patient, they always follow the Indian standard time, which is never on time. So that is difficult because suppose like usually I start my practice at 10 in the morning, 10, one appointment, 11, one appointment, 12, one appointment. What finally happens is that 10 wala, 11 wala, 12 wala, तीनों एक साथ 11 बजे पहुंच जाएंगे. That is at times irritating and that is at times difficult. So try to, there are good patient management softwares available in the market, the paid ones, the free ones are also there. So try to utilize that, but make sure patients should not have to wait too much of time in your waiting area. Suppose you have given an appointment at 11, make sure at least by 11:15, 11:20, you are able to start his work. No, there are exceptions that suppose a 10 o'clock patient, you broke a root and it took more than 1 hour for you to remove the root. That is a rare condition. But in most of the cases, you know very well, okay, I will take 1 hour for a BMP, for example. So give your appointments accordingly and always try to keep few vacant slots between two patients for new patients who are coming to your clinic, because these are the new patients to which you have to work the most. The new patients, you have to give the maximum amount of time, and once the patient is has become your old patient, so you have already gained enough confidence over the patient. So even if he has to wait for a slight period of time, the patient will not mind. But a new patient, he will be very restless. He will be ready to run away because he is always in a hurry, and he has so many options available. Why to waste time only in your clinic, unless and until he has been backed by a very good word of mouth publicity. And one very important thing what I would like to tell all my viewers is ortho practice, ma'am. Even if I'm not an orthodontist, but I pay maximum attention in convincing ortho patients, because ortho patients are the patients. Suppose, like for example, we charge 25,000 for an ortho patient in my clinic. Now, obviously, the orthodontist will take away the 70% thing. I will be getting only 30%. But believe me, that ortho patient is having braces on his teeth and is moving around in the entire society for the next 1.5 2 years. And wherever he goes, people will ask him, where did you get your treatment done? Where is your treatment being done? How is the doctor? Are you satisfied with the treatment? He is a free of cost ready-made banner which is revolving around the society. And believe me, more than what you have earned in an ortho practice from that patient, you will earn more from the patients and relatives which he has referred to your clinic. In every case, I have noticed it. So spend your maximum time in convincing ortho patients.
Right, absolutely correct. So make sure that you have these pointers written down somewhere, and you can start practicing this in your practice.
So that's it for today, guys. I hope you got a fair idea of the importance of having record keeping. Then how do you communicate with patients? How do you educate them? What kind of equipments are required to start off your practice? We have been doing this dental practice management series with Dr. Nishant, and we have broken down this into various small little questions. So if you're someone who would like to know how to set up a dental clinic, how to brand a dental clinic, what equipments are required, and of course what skills are required apart from having hard skills, do check out our dental practice management series playlist, which I have linked in the description box. It will be there on the top I button also, so you can check that out. And before I sign off, don't forget to subscribe, like and share our videos. Of course, do register for the soft skills workshop, because I'm sure this is going to be very, very beneficial. We have already, we have already circulated this in all our social media platforms. The first batch that passed out from this workshop, we have got good reviews from them as well. So you can check out and on our WhatsApp group and other social media platforms, and do register for this workshop. I'm sure it's going to be very, very beneficial, especially for students, interns and fresh dental graduates. So I will sign off now. I will see you in the next video. Until then, bye and good luck.